And welcome to the press conference on the COVID-19 statistics for Nueces County. So I'm going to get started by talking a little bit about what's going on currently. The summer surge in COVID-19 cases appears to be slowing, which is a really good sign. So a friend recently reminded me it's a great opportunity for you families with children to take your kids outdoors, enjoy some fresh air and some fun activities. The vaccination rates are slowly, but they're steadily still increasing, which is also another good sign. COVID-19 seems to be once again in retreat. The reasons remain somewhat unclear as to why that is, and there is no guarantee that the decline in caseloads will continue. We currently have 59% of our eligible population, that's those children 12 years and older, fully vaccinated, which is really good. So thank you to our community for that. The number of new daily cases in Nueces County has fallen significantly since this past August. Just a few months ago in August, we were averaging almost 400 cases a day, and today we're averaging about 80 cases a day. After a long and deadly summer, this is encouraging news moving forward into the fall and winter months. CDC has reported that the most serious forms of COVID-19 variants are also declining. The variant that we continue to see as dominant is the Delta variant. The number of Americans hospitalized with COVID has fallen 25% since September 1st. Daily deaths, which typically lag a few weeks after cases and hospitalizations, have fallen 10% since September 20th. It's the first sustained decline in deaths since early summer. So this is all really good news, and I hope it's encouraging to everybody, because I know everybody gets a lot of anxiety over the COVID-19 numbers. The easing of the summer surge has been attributed to more mask wearing and more people getting vaccinated. The decrease in case numbers could also be due to the virus having gone through susceptible people and running out of fuel in some places. If you're not vaccinated or have protection from natural infection, this virus may still infect you. So we must remain cautious going into the next few months and make sure we're ready for the winter, because our hospital staff have been working really hard, are exhausted, and we need room, for the elective surgeries and other acute infections or illnesses to be taken care of. On September 22nd, the FDA authorized Pfizer booster shots for adults 65 years and older, immunocompromised individuals 18 years and older, and anyone whose occupation puts them at a higher risk of exposure to COVID-19. It must be at least 6 months after the second dose in order to get a booster. So if you receive in January, February, March, you will be eligible currently. Some of the occupations that are also eligible, just for your knowledge, are first responders, healthcare workers, firefighters, police, teachers, daycare workers, correctional officers, postal service workers, public transit workers, grocery store workers, food and agricultural workers as well. FDA will meet on October the 15th and 16th to discuss booster doses of the Moderna vaccine as well as the J&J vaccine. FDA will also meet again on October 26th to discuss Pfizer's request to authorize its COVID-19 shots for those ages 5 to 11 years of age. And I know a lot of people have been asking us when those vaccines will be coming out for the pediatric population, so we're hoping that it'll come out by early November. No vaccines are currently available for children under the age of 12, and only Pfizer shots are available for teens 12 and older. So to kind of change gears a little bit about flu season, I think everybody knows flu season is right around the corner. It starts just a few days ago, October 1st, and it continues through May of 2022. But for us, flu season usually starts a little later because once it starts getting cold, we start seeing flu. We do not have a lot of flu circulating at this time, but as we see flu cases increase, we will again make sure that the public is notified of that. CDC recommends that everyone ages 6 months and older get their flu shot, and that includes pregnant women. COVID-19 mitigation measures such as wearing your face mask, staying home, hand washing, likely contribute to the decline of 2020-2021 flu incidents and hospitalizations and deaths. So we want to do that again this flu season and keep those flu numbers down. Health Department, we will begin offering the flu vaccine to the public later this month. We will partner also with our COVID-19 vaccination sites to give the community an equitable number of locations for vaccine availability. Again, you have to remember that vaccines were ordered a year prior, and so based on the utilization last year was how many we will be giving out this year. So it is still first come, first serve for flu shots. We are planning on reopening the health department. So effective October 18th, our TB clinic will be open. And so we will have phone numbers and they will all be posted on cctexas.com on our website. So please either refer to the website or you can call the health department at 826-7200 and we can give you that information as well. Our STD HIV clinic, as well as our 1115 waiver diabetic clinic, as well as our environmental health clinic will also be opening on November 1st. And so we hope that everybody that needs the services is able to come over and receive those services at the health department. So we all know Halloween's around the corner, so everything's going so quickly here. So I'm going to show you a slide on some CDC tips this year for a safe Halloween. So basically, they're saying a lot of the same things that we saw last year. Avoid direct contact with trick-or-treaters. So stay in your own family units. Give out treats outdoors if possible. Set up stations with individual bag treats for kids to take. Wash your hands before and after handling the treats. You know, a lot of times the kids touch all these things, the doors, the doorknobs. Sometimes they want to, shake hands with the people that are giving them candies. Just make sure that they wash their hands before they actually eat any of that candy. Make sure that they wear a mask. The mask that they wear should be a cloth mask. It shouldn't be the one that actually comes with the costume. If there's one with the costume, like a big plastic mask, that should not be the one that they should be wearing. They should be wearing a cloth mask like we've been wearing for COVID-19. So, and don't wear both. Don't wear the mask that comes with the costume and the mask on top of that, because excuse me, it can be really difficult to breathe, and we don't want that to happen to any of our children. And masks, of course, should not be worn by children under the age of 2. So you can also take hand sanitizer with you when you're out and about trick-or-treating. Again, staying in your family unit, social distancing, going earlier than the rest of the crowd also is helpful. Hand sanitizer with at least 60% alcohol. Parents supervise young children using this hand sanitizer. Again, if they're able to wash their hands, that would be great for at least 20 seconds, of course, before they start eating their treats. Indoors and outdoors, you're more likely to get or spread COVID-19 when you are in close contact with others for a long time. So the recommendation is still that if you are vaccinated, or if you're fully vaccinated, you don't have to wear a mask if you're in a congregate setting, unless you're in an area of high transmissibility. And so currently we're not in an area of high transmissibility because our transmission rate is low right now. We have about an 8% positivity rate. And so, that's good news. But for people that aren't vaccinated, you still need to wear your mask, protect yourself. You don't want to pick up COVID-19. So if you do plan on having an indoor gathering, a Halloween gathering indoors, open your windows. Your windows, getting that air circulating will really help to keep people from getting COVID-19. Now I'm going to jump into the statistics. And so for the first statistics, you see the last 2 weeks of cases, and those are daily cases. And so today you see 102 cases today. And so if you look at this past week, we've had 541 people with COVID-19, and last week there was 679. So the numbers are still coming down, and that's a good thing. And you see a lot of numbers under 100. You see 57, 63, 41. So on average, it's around 80 cases a day. This pie diagram shows all of the cases combined, those people that have recovered. 62,504 people have recovered. Active cases, these are people that still have COVID-19 currently and could still spread COVID-19 to others if they weren't isolating themselves, which they should be. And then 1,213 deaths, 1,213 deaths due to COVID-19, for a total of 65,400 cases in Nueces County since the beginning of the pandemic in March of 2020. The hospitalization cases are also coming down. We did see them kind of drop down to 134 yesterday and kind of, go back up a little to 140. And Dr. Bird will talk more about these specific details of these cases. The ICU patients, it's gone from 2 weeks ago in the mid-80s, and now it's down to around 60 cases in ICU. Again, these patients need more assistance than just the regular med-surg patient, so some of these individuals are also on ventilators. The total deaths, as I mentioned on the pie graph, is 1,213 total deaths, and that is just for Nueces County, and these are COVID-related deaths. And then the fatalities for the last 2 weeks, you'll see, it's hard to see, but here's 0 today. So thank goodness we're starting to see some blanks or zeros. We saw one back 9/26 last week between the 10 fatalities and the 8 fatalities. And so this last week we've had 23 fatalities due to COVID-19, and the week prior we had 41. Finally, I like to end it with something that it just looks like a good visual that you can make decisions, based on this visual. Positive COVID tests since July 1st. If you look at those fully vaccinated, we've had 1,085 people fully vaccinated that actually got COVID-19. And then if you look over here, these individuals were not vaccinated, and we have a total of 18,963 non-vaccinated individuals that got COVID-19 since July 1st of this year. And the last slide we have is COVID inpatients admitted since August 1st. So August, September, and now we're in October. So what you see is on the right side, 119 fully vaccinated individuals that ended up hospitalized, and then you see 878 individuals that were hospitalized that never got a COVID-19 vaccine. So I want to make sure that everybody continues to use their public health strategies. And with that, I'm going to turn it over to Gabby for the translation, and after Gabby, we will have Judge Canales sends her apologies. She could not be here today, but Garrett Nelson, who is the Interim Emergency Management Coordinator for Nueces County, will be here on her behalf to speak next. Thank you.
El número de casos de COVID en el verano parece estar disminuyendo. Las tasas de vacunación están aumentando lentamente pero constantemente. Actualmente tenemos el 59% de nuestra población elegible completamente vacunada. El número de nuevos casos ha disminuido. En agosto estábamos promediando casi 400 casos por día. Hoy estamos promediando 80 casos por día. Los CDC han informado que las formas más graves de variantes de COVID también están disminuyendo. Las muertes han caído un 10% desde el 20 de septiembre. La disminución se ha atribuido a un mayor uso de cubrebocas y a que más personas se encuentran vacunadas. El 22 de septiembre, la FDA, o la Administración de Alimentos y Medicamentos, autorizó las vacunas de refuerzo de Pfizer para adultos mayores de 65 años, individuos inmunodeprimidos mayores de 18 años, pero debe de ser al menos 6 meses después de la segunda dosis. Si se recibió en enero, febrero o marzo, es elegible. Entre ellos, personal de primeros auxilios, trabajadores de salud, entre otros. La FDA se reunirá el 15 y 16 de octubre para discutir las dosis de refuerzo de la vacuna Moderna y la vacuna Johnson & Johnson. La FDA también se va a reunir en octubre para discutir la solicitud de Pfizer para autorizar su inyección de COVID-19 para niños de 5 a 11 años. La temporada de gripe comienza el 1 de octubre y continúa hasta mayo de 2022. Los CDC recomiendan que todas las personas mayores de 6 meses se vacunen contra la influenza. La vacuna COVID-19 y la vacuna contra la influenza se pueden administrar al mismo tiempo, incluyendo a mujeres embarazadas. El Departamento de Salud comenzará a ofrecer la vacuna contra la influenza al público a finales de este mes. También planeamos reabrir la oficina del Distrito de Salud ubicada en la calle Horn. La clínica de tuberculosis reabrirá el 18 de octubre y la clínica del VIH el 1 de noviembre. Cualquier información adicional puede llamar al 826-7200. Le recordamos que si va a salir el Día de Brujas, tome todas sus precauciones, lave sus manos, no tenga contacto directo con otras personas, utilice su cubrebocas adicional, no solamente utilice la máscara de su disfraz. El día de hoy se reportan 102 casos positivos al COVID. Afortunadamente no se reportan decesos el día de hoy. El número de fallecimientos hasta la fecha es de 1,213 personas. Actualmente son 1,683 los casos aún activos y más de 62,000 personas se han recuperado. 140 pacientes continúan en el hospital, 59 de estos en la unidad de cuidados intensivos.
Good afternoon. My name is Garrett Nelson, and I'm the Acting Emergency Management Coordinator for Nueces County. As this is my first time at this podium, I will briefly address who I am and why I'm here. I'm a veteran of Lubbock Fire Rescue and retired after 31 years with the fire service, going from firefighter and equipment operator to my final 9 years as fire marshal. In my time with Lubbock Fire Rescue, I have 17 years of experience in emergency management roles. I have both training and experience in incident management, incident command, and public information in support of evacuee sheltering operations, weather events, pandemic influenza, and disaster recovery. And today, I'm here representing Nueces County and Judge Barbara Canales, who can't be here. Health Director Annette Rodriguez has given you an overview of our current status, and if Judge Canales were here, she'd repeat what she said at the last press conference. The trend is our friend. Hospitalization numbers are going down, and that is a key metric for us. But we're still running above the state of Texas average, but things are moving in the right direction. And Dr. Bird then, after me, will give you a detailed look at what today's numbers mean for the future. From the vantage point of emergency operations planning, we plan based on patterns. Looking at this chart, I'm reminded that history may not repeat itself, but it often rhymes. The wave of infections we had last winter are a warning for this winter. We have been told that we can expect a wave of COVID-19 infections in the winter because COVID-19, being a respiratory virus, thrives in the same conditions of flu season. People are not out in the sun and fresh air as much and may be spending more time indoors in a sealed house or office and in closer contact with people. How bad it could be is not known, but it is prudent to plan for the worst. So while we have this respite between the infection wave of summer and the expected infection wave of winter, here's what we're doing. Nueces County has essentially turned over our vaccination clinic operations to City County Public Health. They are managing the clinics at La Palmera Mall, the Greenwood Senior Center, and at Robstown, the former outlets of Corpus Christi Bay. All open 7 days a week, and at other standalone clinics across the county as we work to make these vaccines safe and accessible. Please go to nuecesknows.com for exact times and locations. And while we're not operating vaccination clinics today, we learned a great deal in the last 10 months, and we'll be able to scale up operations as needed. Nueces County is still involved in testing, and COVID-19 testing is an important part of our pandemic response, particularly with the Delta variant, which is quite aggressive. Early testing at the first signs of symptoms can lead to better outcomes. Testing is also important when traveling to states and countries which require a COVID test for entry, and for access to these private venues which require them. We will continue to support testing for the foreseeable future for those reasons. Another weapon we have to fight the virus is monoclonal antibody treatment. This treatment, when given to COVID-19 patients with mild to moderate symptoms, is delivering great results. It delivers shorter and less severe illnesses, and it keeps people from having to be hospitalized. The Physicians West site for monoclonal antibodies is now transitioning to be vaccinations only. But we're still doing infusion treatment at the Richard M. Borchard Fairgrounds with the support of a state of Texas team. This treatment that I'm talking about requires a doctor's referral and is another good reason to see your healthcare provider as soon as you start to experience symptoms. There's a window where the treatment can help you, and that window closes if you become too ill. I would love to see the numbers continue to go down, but from an emergency management perspective, we are treating the current decline in infections and hospitalizations as a break in the action and are making plans for a winter wave of infections. I'd love for history not to repeat or even rhyme. And the way to do that is for people to get vaccinated and stay safe with good health practices. We have the vaccines, we have the booster shots for those who were vaccinated early this year and are at risk. We have third shots for those with compromised immune systems. COVID thrives in flu season, and flu season is approaching as well. Getting the COVID vaccine does not protect you from the seasonal flu, so we strongly recommend getting an annual flu shot. Finally, hurricane season is not over. And last week we saw that heavy rains can come quickly and create hazardous conditions. I urge everyone to stay prepared, stay informed, and stay safe. And now after the translation, I'll be turning it over to Dr. Bird, Dr. Christopher Bird, Associate Professor at Texas A&M Corpus Christi.
Garrett Nelson, coordinador interino del manejo de emergencias del condado de Nueces, cuenta con 31 años de experiencia como bombero en la ciudad de Lubbock y 17 años de experiencia en funciones de gestión de emergencias. Está capacitado en el manejo de incidentes, comando de incidentes e información pública, en apoyo de operaciones de refugio para evacuados, eventos climáticos, influencia pandémica y recuperación de desastres. Él está aquí a nombre de la juez Bárbara Canales. Los números de hospitalizaciones están disminuyendo y esto es clave para nosotros. La ola de infecciones que tuvimos el invierno pasado es una advertencia para este invierno. El COVID-19, siendo un virus respiratorio, prospera en las mismas condiciones de la temporada de gripe. Las personas no están tanto al tiempo al sol ni al aire fresco y puede pasar más tiempo en interiores en una casa u oficina y en contacto cercano con gente. El condado de Nueces está tomando acción, incluyendo la entrega de todas las operaciones de nuestras clínicas de vacunación al Departamento de Salud Pública de la ciudad y el condado. Las clínicas abiertas al público son en el Centro Comercial La Palmera, el Centro para Adultos Mayores Greenwood y en los antiguos outlets en Robstown, todas abiertas los 7 días de la semana. El condado de Nueces todavía está involucrado en las pruebas de COVID-19, que son una parte importante de nuestra respuesta a la pandemia, especialmente con la variante Delta, que es bastante agresiva. Las pruebas tempranas al primer signo de síntomas pueden conducir a mejores resultados. Continuamos ofreciendo los tratamientos con anticuerpos monoclonales para así combatir los casos, evitar que un paciente enferme seriamente y aminorar el tiempo de los síntomas del virus en el organismo. El sitio en el Physicians West, en el antiguo Hospital Memorial para Anticuerpos Monoclonales, ya está cerrado. Los tratamientos solo se administran en el Centro de Exposiciones Richard Borchard en Robstown. Este tratamiento requiere la referencia médica y es otra buena razón para ver a su doctor tan pronto como comience a experimentar síntomas. Hay una ventana en la que el tratamiento puede ayudarlo y esa ventana se cierra si se enferma demasiado. Contamos con las vacunas de primer, segunda y dosis de refuerzo, así como terceras dosis para aquellos con sistemas inmunológicos débiles. El COVID se estima se va a acentuar durante la temporada de la influenza y la temporada de influenza también se acerca. Recibir la vacuna COVID no lo protege de la gripe estacional, por lo que le recomendamos también recibir una vacuna contra la gripe.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to give you your weekly pandemic report on behalf of the TAMU-CC Informatics and Modeling team. We have 2 objectives on the task force. I know it's repetitive, but we want to remind you guys each week we're here to answer your questions about COVID and to enable evidence-based decision-making. That means that you don't make decisions based on your gut feeling. It means you make decisions based upon the best available evidence that's here. And here's some of the evidence for why you should want to get vaccinated. This is a graphic of the number of reinfections. So this is a little bit different than what you saw from the public health director. And you might think, what about natural immunity? Is that going to protect me from getting COVID? Well, you're much more likely to get reinfected if you're not vaccinated. We have at least 229 reinfections since July 1st for people that weren't vaccinated versus people that were vaccinated. So that's showing you that the natural immunity doesn't work nearly as good as the vaccine immunity does. Next, the majority of infections that we're having in the community are among the people that have not been vaccinated, as you can see on the left-hand side. Now the cases are coming down, and that's a good sign, but we're still in a situation where the youngest people in the coastal bend are testing positive for COVID the most, and we don't want that to be happening. So anyway, it's coming down, but you can see it's not coming down as fast now as it was in the past. So things are starting to level off a little bit here. Here is a graphic showing us calibrating our model to the actual number of cases. The black dots are the number of cases that we're seeing in the past 7 days, each one of those points, against the orange dots, which represent the number of infections modeled in the community. And you can see on the left-hand side, the numbers are much bigger than on the right-hand side of the graph. That's lining up infections to number of cases. And you can see that there is a little bit of a leveling off that's occurring. We're not going down as fast as we were last week. So calibrating the model, we estimate that the transmission rate right now is about 0.75. Cases are slowing down. I would liken it to last week, we were slamming on the brakes, and this week we let off the brakes but haven't hit the gas at all. So still slowing down a bit. So transmission rate is 0.74. What that means is that for every 100 people that get COVID-19, they transmit it on to 74 additional people. So you're getting less and less COVID as you move forward. Looking at the number of people in the ICU, it is coming down according to projection, and that's good. But it's not coming down that quickly. If you look back to just the winter peak, which is right in the middle of this graph, you can see that we're right about where we were at the winter peak. Right now, coming off this really large Delta peak, which was almost as high as the summer of 2020. So right now, we're coming down, but we're still at a high level of people with COVID in our ICUs. Same thing for the number of inpatients in the coastal bend. It's coming down, but there's still a lot of inpatients with COVID in the coastal bend, and we expect this is going to continue to decrease. Right now, we're at 18% of the hospital capacity in the coastal bend is dedicated to COVID patients. This is a lot better than the 40% that we got up to in this Delta wave, but we're still above that 15% threshold, which used to trigger businesses going to 50% occupancy, right? So while it's coming down, we shouldn't be letting our guards down right now because we're still well above the red zone threshold, which is represented by these red dots going across the screen. If you look at the risk analysis for COVID in the community, these red dots mean above that level, there's high risk. In terms of vacancy, this is the thing that concerns me the most, and still, is that there's really low vacancy in our hospitals in the coastal bend in inpatient beds. Now it's going up, it's starting to move in the right direction. We're at 5.35% of the beds in the coastal bend hospitals are available for additional inpatients right now. These are staffed beds. But you can see normally we're at 35–40%. So we've got a long ways to go for the beds to open up and us to have normal hospital care. This is probably the most important graph I'm going to show this week, and you've heard me say kind of over and over again, it takes a long time for the state to count the death certificates. And right now it's taking especially long. It's taking a month, and there's a big delay. And so we've now found that the deadliest week for COVID that we've seen in the coastal bend occurred at the end of August and the beginning of September, where we exceeded 100 COVID fatalities within one 7-day period. And it didn't just happen once, it happened a couple times in there. And I want to reiterate that these values could still increase because the cases are still being counted. It looks like there's a bad fit between our model and the data, but I've been telling you this every time I get up here, that this kind of downward trend, while now it's probably actually something that's happening, the model's not a bad fit. It's just the data hasn't been counted to the point where it's going to fit the model. Basically, the model's not changing right now, and each week you're seeing these points get closer and closer to the model that we projected. And so we expect that there could be a couple more days that go above, or a couple more data points that go above 100 COVID fatalities in a 7-day period. So in summary, everything's going down right now in terms of COVID. New cases, hospitalizations, and fatalities are indeed declining. The fatalities are still being counted, and for that reason, I expect that those data points that I showed on the previous graph will continue to rise, even though they're from a month ago. Recommendations, number one, get vaccinated. What's the best way to stop the next wave? You've seen 3 graphs that show these massive red bars for people that weren't vaccinated getting COVID, and these very tiny green bars for people that were vaccinated getting COVID. So get vaccinated. That'll stop the next wave, whatever Greek letter that gets assigned to that. 2, if you're symptomatic, self-isolate, take it serious. I know that when it's you, when it's me, I didn't think that I had COVID when I had it. And luckily, the public health director told me, no, you don't know, you have to get tested. And sure enough, I had COVID. And luckily, I self-isolated. I'm pretty sure I didn't pass it on to anybody else. And that's the way you stop COVID, is you don't pass it on to anybody else. You get tested. If you're positive, then immediately try to get the monoclonal antibodies, because those will help you from having to go to the hospital. And if you're in the hospital, you can't get the monoclonal antibodies anymore. And I want to remind you that the monoclonal antibodies are free for us here in the Coastal Bend. And for most other people in the United States, they're very expensive, and you have to pay for them. Here, they're free. This is the same monoclonal antibody treatment that former President Trump got. So it's the presidential treatment. You get it here. Make sure that you sign up for that if you test positive. You can contact the public health department. They'll be able to connect you, or you contact your doctor. They'll also be able to connect you with the monoclonal antibodies. And lastly, the masks work. If you're out in public, in a crowd, indoors or outdoors, you should probably put on a mask and maintain your distance, and it does help to slow down the spread of COVID. So that's a report for this week. I should be back in 2 weeks to give you an update, and after the translation, we'll go to questions with the Public Health Director, Annette Rodriguez. Thank you.
En el condado de Nueces, los casos de personas que se han contagiado por segunda ocasión de COVID es de 27 pacientes que estaban completamente vacunados y 229 personas no vacunadas contra el COVID. Las cifras de casos positivos en el condado de Nueces continúan declinando, especialmente de personas mayores de 60 años. El radio de transmisión también ha bajado y se encuentra en 0.74, lo que significa que de 100 personas que portan el virus, potencialmente pueden enfermar a 74 más. También han disminuido los casos en los hospitales y en la unidad de cuidados intensivos. El 18% de los pacientes en los hospitales locales son atendidos por COVID. La unidad de cuidados intensivos también ha disminuido. Los hospitales continúan teniendo pocas vacantes. El promedio es del 5.3% de vacantes en los hospitales locales. Durante la semana del 3 de septiembre se reportó el mayor número de decesos por COVID desde el principio de la pandemia. Las recomendaciones continúan siendo las mismas. Para evitar el aumento de contagios, vacúnese. Si cuenta con síntomas, aíslese. Tómese la prueba. Si resulta positivo a la presencia del virus, obtenga el tratamiento de anticuerpos monoclonales y continúe utilizando su cubrebocas y, sobre todo, siga practicando el distanciamiento social.
Thank you. Do we have any questions? No? Thank you all for being here. We really appreciate it, and we will be back in 2 weeks for our COVID-19 update. Thank you.